Hey guys, and welcome back to HMRK. H here, and as you can see, I've got a hospital gown on. I'm at hospital in this private cordoned off room. I came here, was admitted to hospital early Friday morning, Friday the 13th of March of all days. Can you believe that? Friday the 13th of March. And I end up here in hospital. However, and what is it? Will be on Monday. Sorry, I'm losing a track of time here. So it's actually now Monday, the 16th of March. Around about not even sure what the time is. Must be about 2 o'clock in the afternoon now, 2:30, around about that time. And I've just had something to eat, and just thought I'd kind of do an update video. I haven't actually been active at all recently, just simply because I've not been well, and what it was I became ill on the 9th or the 10th of March, which is the previous Monday. Nothing, just a little an innocent cough. Started with an innocent cough and progressively got worse, symptoms being in the end a really bad cough, a really dry sore throat. That's just like the Arabian desert. It was just so dry, and a fever, up and down, really high temperature, went really high and then would go really low, and I just felt achy, and just typical conditions to what I initially thought was a common cold. And then as the week progressed to Tuesday to Wednesday, it was, this is more flu-like, and did the normal thing called 111, because obviously, as we know, we are in the midst of a global pandemic. And so obviously wise to call 111. Spoke to someone on the phone, went through their run book, and their run book was basically, you look like you got a cold viral infection, just continue to stay at home and self-isolate, that kind of stuff. So again, took the advice, gave it another day, and spoke to a GP surgery the following day. They didn't want nothing to do with me, didn't want me to come near the surgery. This has never seen anything like it, to be honest with you. It was like, where's the duty of care? But apparently got told that everything was kind of going into lockdown. So in the end, Sharon, my beautiful wife Sharon, decided that enough is enough, and we're going to A&E. So came here Friday, and initial observations was my temperature was in excess of 40 degrees, and I had a really high heart rate, and my breathing wasn't great actually, wasn't good at all. And here at the hospital, where they've been taking wonderful care of me, by the way, it's been brilliant actually. They went through what they do here. They went through their run book here, and tested me. Obviously, gave me an X-ray, gave me had a stethoscope on my back. Could hear, obviously, there was crackling in my lungs, and they obviously put me on a, I don't know if you can see here, I've got an IV here, so put me on a drip, started getting me hydrated. I was severely dehydrated at this stage as well, so just getting me hydrated again, and basically I had the test for coronavirus. So I've been in hospital over the weekend, getting myself on the mend basically. So I feel a lot better. It's really weird because, like, although it's been going on kind of, as us as a family, have just been kind of heeding the advice of that we've been hearing from the government, from the website. Just crack on with general life, but just make sure you do the normal stuff. Wash your hands, and which we all do anyway. So it's just one of them things. You could get it anywhere. You could door handle, bus handle, tube handle, sweet shop, gym, down the pub, just anywhere. It's so easy to pick this virus up. It's easily transferable. So it's the reason why it's across the world at the moment, across the globe. Even in Europe now, the major epicenter of the pandemic, Italy, Spain, France, the three big ones at the moment. I've been obviously not had much to do here, so I've been kind of just reading up on the coronavirus. I'm almost an expert now, I'd say, of the amount of the videos I've watched on the coronavirus. But I'm pleased I'm still here, especially when you hear that yesterday 358 people sadly lost their lives in Spain in a single day. So it's really real, and obviously for those of you who actually follow our channel, and follow my family, and obviously we're Tottenham fans, and we haven't done a preview or a vlog for a while, and the reason we didn't do one for instance for the Champions League one was we weren't well. Actually, Indy, my daughter, she's an absolute trooper. She actually had very or almost the same symptoms as me, and she one, didn't require any hospitalization. Two, she's just took it in a stride, running around, and pretty much back to full health actually. So unbelievable really. The doctor did say here actually that the saving grace really is that is with the children, that is that they just don't really seem to be affected by it at all. They just take it in their stride. Unfortunately, it is the elderly from 60s plus that seem to be struggling. Obviously, it takes its toll on your body. I can vouch for that. It is honestly one of the worst things I've had to deal with probably in my life in terms of an illness. It just kind of eats you up basically, and you need some serious strength for this virus. So I really kind of just personally just pray that this dies down very quickly, and that people do not lose many loved ones. Unfortunately and inevitably it will be the case, but hopefully that can be restricted with measures that hopefully our leadership, that's Boris Johnson, come up with a good solution or a solution. I've been hearing about private hospitals now opening up their beds and stuff. Hopefully that will be the case. Obviously, I think I came in on Friday, I think Callum Hudson-Odoi himself was was it on Friday that he actually said that he had tested positive for it. Mikel Arteta, forget that he's the Arsenal manager, and Arsenal are sworn enemies. He's a human being, and as even as a Spurs fan, as human beings, we need to be there for each other. So wishing anyone who has this a speedy recovery, wishing them well. Want as many people to recover from this as possible, and wishing the guys who are looking for a what do they call it, a vaccine. They're working hard, and all the frontline nurses, doctors who working ever so hard, just keep up. They're doing a fantastic job, a splendid job. You know, I've never really, never been to hospital, but never stayed in hospital, so I've never really seen what actually nurses do. I mean, they've been coming in and honestly looking after me fantastically well, ensuring that I get all my medicine on time, and just honestly from the ground up, just fantastic. So loads of kudos there. Hopefully I will be leaving today. However, I could be here for one more night, but just looking forward to going home now. Glad this kind of nightmare is over for me. Smiling for the first time, because this last week I've not been smiling at all, actually. Not been fun being in bed pretty much all day, but just glad I'm coming towards the end. And spoke to the doctor today. He said it still will take 2 to 3 weeks to get back up to anywhere near 90% even. So I reckon I'm looking at between 4 to 6 weeks to get to 100% now, and probably I'll be taking antibiotics for 2 more weeks on top of when I'm discharged. They're just putting an action plan together for me. I'd imagine I'll be back here again for an x-ray to see if the pneumonia is cleared up. So as always, catch us on the next one, and come on NHS.
Hi guys, welcome back to HMRK, and no, today we're not doing a match preview. But look who's back.
Yes, I'm back out of hospital. Was discharged yesterday. And let's start by first saying I tested negative for the coronavirus. Yes. So after being told by about 3 or 4, 5 different doctors that I almost certainly had the coronavirus, even on handover to the ward, on handover, the doctor said to the nurse, "This is a 99% certain case. I don't have coronavirus." I'm so happy about that. We're so pleased, aren't we?
Yeah.
It wasn't fun being at hospital. You guys missed me for 3 days.
I think it was really boring at home.
You wasn't well either.
No.
So Indy's not been well.
I was just isolated in a room.
Yeah, she was isolated in a room. But, having needles poked into you and IVs and blood taken and ECGs and x-rays, and
it's really sad that people, when you go to hospital, you have to do all that, and then the results, they come back and then they're negative.
Well, it's not sad, it's good news, because they've got to do...
I know, but then you have to go through all that.
No, but they still have to do that. That's their job, isn't it? They've got to make sure that Daddy wasn't well, so they had to make sure that they had to get me better. So they done by the way, the NHS done a wonderful job. I'm so happy with the efforts that the NHS put in. All the doctors, all the nurses, you guys rock. I'm back where I belong, back with my family. And we could start doing some football content again. Yeah. But there's no football. But I'm sure we'll think of something.
Yeah. Maybe we can boxing.
Maybe. Yeah. Oh yeah. Maybe we can do some boxing content. Who knows? But our partnership, we'll think of something.
Yeah.
But I'm feeling better. Thanks to everyone's well wishes. They know who they are anyway, who have been contacting me and just seeing how I've been doing. But I'm back, and
back.
yes, I'm back.
To rock some good content.
Yes. So as always, catch you on the next one. Come on, you Spurs.